Welcome to the deep dive of Key to My Research, the science podcast by the Excellence Strategy at the University of Tübingen. My name is Jennifer, I'm your host, and in this episode we will take a closer look at the research of Professor Dr. Ghazaleh Tabatabai. She is, amongst others, Professor for Neuro-Oncology at the University of Tübingen and the Medical Director of the Department of Neurology at the University Hospital Tübingen. Welcome to our podcast today.
Thank you so much. Thank you for having me.
So great that you're here, and we're of course very intrigued by your many academic titles. So could you tell us a bit about your career path and what led you to the position you are in today?
Yes, of course. So I started, let's say, my academic education at the university in Düsseldorf. I was also raised in Düsseldorf, so went to school there, so medical school Düsseldorf. And during this medical school that I finished in 2001, I already was engaged in several activities. So I did my doctoral thesis in medicine during this med school, and that was a topic in neuropathology on glioblastoma. So basically, first way of getting into contact with neuro-oncology. Supervisor was Professor Guido Reifenberger, and that was an experimental doctoral thesis that actually was quite demanding. And this is why I extended my medical school by 2 semesters. So just to have time to dedicate my work to the experimental thesis. Second thing that I did parallel to the medical school was participating as a tutor in a pilot project that had the intention to improve the quality of education. And at that time, that was something that was not that, let's say, common like it is today, to really pay so much attention to the way we educate students. So the topic of that pilot project at that time was to teach different imaging modalities using small groups of students. So we had computer tomography, with sonography, with different imaging modalities. And we were first educated as a kind of tutor to be able to train students and then trained students. And I was quite intrigued by the results that you generate if you have small groups and you can really intensify the topic that you want to educate. So that was something. And then also something that I retrospectively consider as very relevant, if I now look back and where I had the possibility to gain experience from, I did night shifts as a student and in an intensive care unit in a hospital in Düsseldorf, so Marienhospital Düsseldorf, which of course was both activities, was also to earn money, right? I mean, in parallel to medical school. But both activities, be it this tutor's activity in the education part and also this night shifts, really allowed to get more insight into the daily work, you know. So, I mean, intensive care unit, you have, of course, clinical work, this education part, then for, you know, later on for education. So that was probably, you know, the things that shaped me during medical school. And then the last year of med school was then for me, the opportunity to go to the Massachusetts General Hospital in Boston to work there in the Department of Neurology at the Brain Tumor Center in Boston. And I can tell you right now, again, retrospectively, that was probably the eye-opening experience for me, because the way at that time, and that was 2000, 2001, so really long time ago, the way interdisciplinary work was somehow a part of everyday life, that was amazing at that time. And also the way students were empowered and engaged. So I vividly recall when we had a grant round with one of the consultants. We went there with the residents and senior physicians, and everyone was there around. And I was one of the students. And we were standing in a patient, and then the resident was reporting, and then the consultant just turned around to me as a foreign student and said, "So what is your opinion about this?" I said, "Me?" So I just turned around, "Me? Really, me?" So that was something that I can tell you during my whole medical school in Düsseldorf, as sad as it is, I have to confess, never ever happened to me. So this is something that I really think is a key to empower and students, because of course then you feel engaged, you feel seen, you feel heard, and then you also feel responsible for contributing. So that was very important. Well, 2001 I graduated from med school, and then I went to Zurich 2001 to 2003 to join the Department of Neuropathology with Adriano Aguzzi. Also a very important aspect of my academic education, because it was, getting insight into the morphology of different brain diseases and also the morphology of different tumors. And at that time, for instance, also Professor Kleihus was still quite active in Zurich. So it was very interesting to somehow be inspired by these great people and to learn more about the subject. Still, I decided that I do not want to go to neuropathology, but I want to really go to neurology. And this is why then from Zurich, I went to Tübingen to do my neurology residency. And again, during that time, I was already involved in research activities. So I completed a doctorate program at the Graduate Training Center for Neuroscience, working on brain tumor research. And there it was, the main topic was work on novel strategies of delivery to intratumoral brain tumors. And that was until 2008, where I then got the board certification for neurology. Then it was Zurich again, So, but this time Department of Neurology, where I joined the department of Professor Weller, where I stayed until 2014. I was also research group leader at that time in the Center for Neuroscience in Zurich, and completed my habilitation and also did a certificate of advanced studies in clinical trials management, which is also something that is a very important part of clinical academic work, so to say. And well, then a professorship was advertised in Tübingen. I applied, obviously successfully, and since 2014, here I am.
Here you are. So you have this extraordinary career. You have a CV, which is probably not comparable to other CVs. And it's characterized by this constant drive, constant development. Where does this drive come from?
Well, I would rather call it curiosity and the passion for learning somehow, because at the end of the day, I think growth is something that is very important for our life in every area, in research and in education, whatever. And you basically grow by looking for new challenges. And of course, if you are passionate about these challenges, then it's even easier, right? But whenever, or if you're only in rooms where you feel you are the smartest in the room, you are definitely in the wrong rooms, in my opinion. So you have to go out of your comfort zone and you have to look for new topics and also new areas of growth. And I must say, there's so many. If you are really honest to yourself, you really see that, in this or that area, you might still, need some further education, input, inspiration, and so on. In fact, also since I was appointed as a professor here, I completed a certificate in advanced study in management and healthcare at the University of St. Gallen, because that is also a very fantastic program that you can do in parallel to your professional life. And I can only say, so that was probably my approach. It was not that I always was looking, I need that title, I need that title, and this one, but rather really, this is a content where I really would like to dive into a little bit deeper and look, and where will this be possible, or who could really teach me more on this, or where can I get more involved to have new challenges? And these challenges, of course, make me come out of the comfort zone and then addressing new aspects.
Successful people in different fields often have a mentor. Did you have anyone that sort of helped you along the way, or was it your independent power, so to say?
Of course, I had a lot of great people where I had the honor to work with, where every one of these people really had specific, be it characteristics, be it skills, be it methods, be it conversation techniques, whatever. So everyone really had a very, very unique expertise that certainly was helpful. But it was never in a way that I had someone really looking up to or a really kind of role model, So
over a longer period.
No. Of course, again, I had really very, very great department chairs where I worked with and very inspirational talks with many of them. But it was not like specific, okay, now let's have a look. Do you need this one or do you need that one? So what is nowadays, so I'm involved as a mentor in many mentoring programs, actually. What I see is that mentee ask us, right? So for me, it was not like this.
Okay. And what are the factors you have defined which have formed your success?
So if I look back, I think one major aspect is, at the end of the day, a certain way of self-management, certain way of discipline, or really having the right mindset or attitude in a specific situation. Of course, this is nothing that you are born with. It's a muscle that you need to train and train and train again. And there is no universal recipe to it, right? But I think the main difference is actually really in mindset and attitude, and not that much in the specific skill that you need to or the specific technical skill, but rather in a mindset and attitude. And I think what is also something that I think I have developed quite well over the years is a certain type of ownership. So I think excuses, blaming, complaining, all these things, lead to nowhere. So you really have to see how you can take over responsibility and find your way through it. And again, this continuous learning and this continuous also kind of curiosity, this is a good driver for really maintaining such a mindset and attitude and discipline towards the challenges, and particularly when facing the challenges. And along with these self-management attitude, I think if you try to manage your energy in a way that you can control yourself and really feel a kind of inner balance, even when facing storms, then I think that's something that's very powerful.
Yeah, that makes sense.
Right? I mean, also in everyday life, right? It makes sense. I mean,
sure. So these factors work for you as an individual, but what advice would you give to young medical students starting off their careers?
So I would first, of course, try to define your goal. So what is your goal? And if you have found what this is, then no one should stop you. And this is, of course, something that's very easily said, super easily said. But already the first thing to really find your goal is something that might not be so easy and might also change every now and then. So this is why reflection is always very important. So, I mean, when you say, you decide, okay, now I start med school, or now I start, biochemistry, or now I start biology, whatever, then you have a certain, starting, driving and everything. Still, it's important, every 6 months or 12 months, briefly, reflect and look retrospectively. Am I doing right? Is this really the thing that I had anticipated? And is this the thing that will probably lead me to the goal that I somehow have in mind? And also, these kinds of goals can also change, during the. So be adaptive. Try to stay adaptive, but once you have your goal, be very determined. And I have to confess, it's hard. It's hard. So there is no shortcut.
There must have been some challenges. It can't have been easy all the time. Yeah. So what was your biggest challenge looking back, reflecting your career?
Up to now. So many. So we would sit until tomorrow morning, Too many. But again, probably put it into a general aspect. If you don't have challenges, if you don't fail, if you do not make mistakes, then you haven't tried. So what I want to say is challenges, failures, mistakes are absolutely part of the journey. And the main thing is to learn to handle these situations, to really learn from these situations and then move on.
Mm-hmm. To have the mindset of having successfully failed, which you have in the startup scene, for example. Failure can be a success because you can start your next project. Would you sign that?
Absolutely, fully sign that. And also there, particularly from this, let's say, startup mentality, failure must be actually an option. It's not like, in some sports disciplines where you say failure is no option when you go and have a team challenge and you want to really prepare yourself and say, but, if you're really going and exploring terra incognita at some point, if you fail, then you say, okay, good. And make sure to fail early and then learn from that and then move forward.
Now, we've talked about your motivation. Now, I'd really like to dive a bit deeper into your research. So what does your current research focus on?
We want to improve therapeutic strategies for patients with brain tumors. We do it in clinical projects and also in preclinical and, let's say, so-called wet lab projects. And in everything that is in our lab is mainly focused on glioma and on leptomeningeal disease. So these are, two areas where we had been particularly active within the last years. And what we want to find out by our research is whether there are any specific vulnerabilities that these tumors have at certain stage of their development or during therapy that we can exploit, again, therapeutically, to design combination therapies. Because we deal with tumor diseases that also, again, generally spoken, have learned to escape from therapy. So whatever therapy you apply, somehow these tumor cells are smart enough to find a way to survive anyway. But there is a certain window of opportunity where they have not yet found this escape route. And we really want to define where is this window of opportunity and how to exploit that and what really shapes this window of opportunity. This might well be specific molecular alterations that occur during treatment and that we can then use as novel targets for treatment and then coming up with combination therapies. Or this might be specific, let's say, immunological features where one could, design specific immunotherapies for these patients. And the second big topic, so the first would be, therapeutic strategies. And the second topic, also a little bit more general, to understand really underlying molecular biology better of these diseases. And there, what is very helpful for us are so-called bed-to-bench side approaches. Mm-hmm. So, for instance, we have patients that receive now within the Center for Personalized Medicine receive targeted therapies, and we see some of them respond well, some of them do not respond well. And then we look at the molecular profiles of these patients and look at the molecular profiles of their tumors and see sometimes very surprising things that we would never have thought of that occur in the context of this disease. Then we can go ahead and take this very specific molecular event and model that in our lab to find out, is this something that is relevant? Is this something that contributes to the disease, yes or no? And this is why we call, or it is usually called bed-to-bench side, because you find something in a patient that surprises you and you do not know what that means. And then you go back to the bench, so to the lab, to model that and to find out how this really works. And the third big pillar, of course, are, since we are in the clinical field, also our early phase clinical trials, so phase 1 trials. This is a very early application of experimental therapies within a clinical trial where you can really see whether, based on a biological rationale that you usually, again, derive from preclinical work, based on a biological rationale, you can really induce specific changes in the disease of these patients.
Could you give us an example of a current research challenge that you're also very passionate about?
Oh, absolutely. So I'm very passionate about an initiative that we have together with very different disciplines, engineers, neuroscientists, clinicians, between 2 universities. And the overall mission is to develop technologies, to combine these technologies with recent insights in neuroscience and clinical settings, to develop neurotechnologies, or let's say future neurotechnology, that will serve neurology patients and will push beyond existing limitations of current treatments and support systems that currently are available for neurology patients. This is, of course, a very broad and overall goal and an overall mission. We need to consider, however, that is very relevant if we consider the burden of neurological diseases that are on a worldwide scale and really lead to limitations in everyday lives of a lot of patients and a lot of people around the world. So there is a recent statistics that more than 40% of the whole world population is affected by diseases of the nervous system in a way that in some aspects of their daily life, they are limitations. So this is why I'm super passionate about this initiative, because we would exactly address this, let's say, this unmet need by a totally innovative approach. And again, this is only possible because expertise from different areas are combined and will create synergy. So this is a really an initiative that I really think has a super high potential and is really something that will make a difference for the life of many patients in the far future, of course.
Mm-hmm. So I just have another question regarding the first field of your research and the experimental strategies you're developing. Could you give us an example of what an experimental alternative form of therapy could look like versus the classic one?
Mm-hmm. So one quite recent one is when you see, for instance, we have a glioma model where we know that specific pathways contribute to the disease, or you know that during treatment, specific pathways are involved. Then we go ahead and apply this treatment and then watch how these tumor cells change during this treatment. This is something that we do using functional genomics. So we have a specific workflow that we established in our lab to dynamically watch how these tumor cells change during this application of specific therapies. And the therapies that we use in the first place are therapies that are already available. And then we can, after a certain course of treatment, we can then see, so which of these molecular alterations helped the tumor cells to survive through this treatment period. What is it? And this is a bioinformatics algorithm that you can then apply to somehow compare the result after the treatment with the starting pool of your cells. And then the next step is, so you discover certain targets, and then the next step is to validate these targets, right? I mean, to see, Are there, for instance, are there specific genes that you then go ahead and then you perform a silencing of these genes and see whether you can generate the same effect, yes or no? Then the step afterwards would be, is there any drug available that could lead to the silencing of this gene, and then in combination with the therapy previously applied would even enhance the treatment.
Maybe another question regarding a typical day. Is there a typical day for you, or is there no repetition?
There is no real classical day in a way. So every day in the morning, 7:30 is this, 8 is this, and 8:30 is that. However, having discussed the different roles that I'm engaged with, being, the clinical work or the lab work or, certain administrative management things. Of course, there are certain phases during a day where the focus is, let's say, purely on clinical work, or the focus is purely on research and the lab, or purely, sitting in commissions or others. But it's rather a mixture of all these different roles, and time management is certainly something that is also, having talked about factors of success, I think time management is definitely something that is a very important skill. And this is also, again, a muscle that you need to train. But I think I'm quite good at it by now.
Talking about roles, so you're a researcher, you're a doctor, but you're also a social being, you have a family. How do you manage this balance between the different worlds?
Again, I think it's how you manage yourself and how you manage your energy and how you manage your time. And I think one very important aspect is whenever, let's say, you are in a specific role, really focus on this one. Do not think of everything else, right? I mean, if you're, let's say, with a patient, then the patient is the only thing that matters. It's not that you think, I should be there or I should do this or, so really also managing your focus and managing your attention in a way will definitely also make you more present within the very tasks that you're doing right now, and will, I think, will somehow protect you from total chaos somehow, right?
It's nearly a Buddhist approach, being present in the moment. So this is something which obviously helps managing a chaotic or a very busy day.
Yeah, and I mean, usually also another thing that helps is to somehow anticipate what might happen, right? Because it's very rare, and I don't think only in our lives, the general. I mean, if you also look, a lot of things are not predictable, right? So you can have two ways of dealing with that. Saying, okay, it's not predictable, so okay, lean back and see what happens. What I think is the better way of dealing with it is to at least anticipate potential scenarios that might happen, and then try to get yourself prepared with. Again, this is something that is much easier to explain in a clinical setting than in research. Basically, it's part of the work that it's not predicted, right? I mean, if you could predict it, it would not be a scientific question, right? So, I mean, this is something that they do learn to deal with it every day. And I think this is also helpful if you are engaged a lot in research and try to adapt or to apply this mindset that is very, unique and very the core of research, to apply that to other areas of life. And in clinical work, particularly, is, if you have a treatment and then you just anticipate what might be specific scenarios that could happen. And then get yourself prepared for that, get the team prepared for that, and get, all the skills necessary prepared for that. And then if this happens, then everyone somehow is much more able to deal with that. So I think really anticipation is also very, very important, particularly in nowadays where you basically cannot really predict a lot.
one of your roles is being one of the principal investigators of the IFIT cluster. So what is the focus of this cluster?
For IFIT, the main feature is here to really combine world-class expertise from 3 different research areas to create synergy and then basically catalyze different research projects that address relevant questions. The overarching topic is, coming back again to the research question, is we know that tumors learn to escape from therapies, and very conventional ways of understanding how they escape have been, purely looking for molecular characterizations, performing, for instance, sequencing or whatever to see how do these tumors change before and after therapy. So in IFIT, the strategy is when we look at molecular alterations, and this is research area A, then it's based on function. So the research area A is called functionally instructed molecular therapies. So what does this functionally instructed mean? This means that the target discovery is accomplished by functional genomics. So it's a specific way of target discovery. It's different from just sequencing before and after, for instance. It's performing a functional genomics approach, for instance, using be it shRNA libraries or guide RNA libraries that cover either specific genes or even cover the whole genome. This technique allows then to discover targets, be it just during tumor growth or during tumor therapies. And then this will help to identify targets that might be relevant in this context. And the important feature of IFIT is that this is not the only approach, but this is combined with Area B, which is immunotherapy. Immunotherapy, there, of course, there are the development of innovative immunotherapies, be it therapeutic vaccines, cellular therapies, bispecific antibodies, and so on. But the beauty here is that those information that you have in research area A then might very well be relevant for designing or, let's say, using the power of the immune system to also really address this specific context. And then area C is also a very important next step, which is basically molecular imaging and modern features of visualizing molecular events, be it in the cell or be it in the tumor. So applying advanced microscopy techniques, advanced intravital microscopy techniques, or PET imaging. And if you now look at a circle covering area A, B, and C, you have the unique combination or the unique vision of having molecular therapies plus immunotherapies plus a method to visualize all the relevant molecular events. And this is by now quite generally spoken, but we see in all the projects that had been conducted in the first funding period so far that actually really the synergy of these 3 areas, this is the key to really push that forward. And this is something that is absolutely unique to the University of Tübingen, because having synergies in all these 3 areas is required. And this is something that we can really work on here, and we can really design these projects with all these different principal investigators that are involved in IFIT.
Mm-hmm. So the synergies equal innovation. Is that what you would say is the innovative part of the cluster?
Yes. So the innovation is basically creating synergy between these 3 research areas. Each research area is certainly a super important one, and there might be also other, let's say, universities that are strong in specific or in one of these areas, but really having this world-class expertise in all these 3 areas and then trying to find those specific ways of interacting between these 3 areas. This is something that's quite unique to IFIT.
Where do these research questions come from? Do they come directly from the patient, or how do you generate them?
So, of course, each of these areas have specific questions that are generated from the field, right? I mean, so let's take immunotherapy. If you now work on developing therapeutic vaccines, of course, there are many different diseases where you envision to design specific vaccines that are able to mobilize the immune system against this specific disease, right? So, I mean, this is something that is generally within the field of immunotherapy. But now, when you think you want to combine it with molecular therapies, you need the expertise of this other research area that basically can come up with specific targets that are then important for novel molecular therapies. And then you can ask the question, this specific molecular therapy, when I apply this be it in preclinical models or some of them probably have also already been applied to patients, does this modify the immune response in a way? Yes or no, right? And then you can take that track and say, okay, if it does somehow, can this be exploited and then be combined with immunotherapy in this setting? So the research questions, the specific IFID research questions are really something that are team questions. So they only come up when you have people with different expertise thinking about a problem from different perspectives. Then these very specific IFID questions are generated. And of course, each research area has genuine questions that are addressed. But the beauty here is really to have the combined expertise and then come up with potential novel views on that.
And looking into the future, is there a specific question you would like to tackle personally?
Absolutely. As I said, since we really work since many years on improving therapeutic strategies for brain tumor patients, of course, our vision is to have combinations from meaningful molecular therapies with good immunotherapeutic strategies. This sounds super easy right now, but I mean, to really find the correct time point when to apply which treatment modality. The second is to really find the right strategy to apply these treatments. And the third one, really also the right delivery route to apply these treatments. It has a lot of variables, but I think by now we have our preclinical models where we can really investigate each and every different scenario. Of course, it's a lot of work, no question about it, but it's possible to really address each single question and then at the end of the day come up with a concept that can then be the foundation of a clinical trial that then teaches us whether everything that we learned from the preclinical models can now really be helpful for the patients.
And what does work within the cluster look like? Could you describe it?
Yeah, of course. So since we discussed that, interaction, synergy is something that is very important. Of course, a key feature of a cluster life is to have platforms, meetings where one meets, discusses, and comes up with ideas. Certainly, there are also specific education topics. For instance, there is a Lunch and Learn seminar series where, we meet, there is a lunch back, right? I mean, there's a super speaker and then discuss over lunch. There are certain technical seminars, right, where with specific technical features are taught. They are, of course, in a regular way, IFID seminars where people from the cluster present their work. There are IFID symposia where also external speakers are invited. IFID retreats, where we have then much more time to really dig into the different topics. So the cluster life per se is a interaction life because we are all, of course, in our labs, we all work, right? We all do and we know what we do, but it's really those moments of interaction that shapes a cluster and brings it to life, because at the end of the day, it must happen during the interaction.
It actually sounds a bit like your CV, so very driven, very busy, lots of further development. So that must be right up your line.
Absolutely, absolutely. And again there, be it in IFIT or in new cluster initiatives that have been generated at our university, this principle of, if you are the smartest in the room, then you are in the wrong room. In the cluster initiative, you definitely, and if you are in the right cluster, right, you definitely, you are never the smartest in the room, because whenever, if you think of 3 different research areas, you cannot be a world expert in all of these, right? So it's per definition that you always see, okay, so this I didn't even know, or this I don't even understand. So there are sometimes also scenarios where you in the beginning think, what is this? And then you go after it, and then you learn about it, and then you study and go. So as you say, so really full in line with these principles.
And you're still in the right room.
Absolutely in the right room, because I'm definitely not the smartest.
Hard to believe, but okay. Okay, I'd just like to talk a bit about your life next to the lab. I hope it exists. I'm sure it exists.
It does, don't worry.
Good. Could you tell us a bit about how you balance out your highly demanding and highly interesting job?
Yeah, so having spoken about roles, so my role number 1 is mother and wife. So I'm probably not a mother and wife. And of course, good friend to many people. Yeah. So for me, when we had the chance to talk already a little bit about, self-management, energy management, and so on. So the question, or to catch up on that, in order to be able to manage your energy and manage your inner balance, you need to find what nourishes your inner balance, right? And I can absolutely tell you, my family, family, and then friends, energy management, of course, a lot goes along with physical activity, so sports is very important. For getting new inspirations, whatever. So I really like reading. It's something that I can tell already, when I was a child, think of my parents, thinking it's always, books and reading books and discussing about books, discussing about lyrics, discussing about all these aspects have been so, let's say, so fundamentally important, and also from the very beginning of my life had played a big role. So this is something that is absolutely part of my day, right?
Mm-hmm. And are you into a certain type of book?
So this also definitely changes over the years. So I turned 50 this year. So if you
congratulations.
Think, thank you. So
couldn't believe it.
Thank you so much. Could be, of course, 40 years ago, I read something else right now. So what I have to confess, all my passion for lyrics basically started after school. So I hope my teachers don't listen. But during school, to be honest, I didn't like the approach that we had to lyrics. So that was so technical and everything. So it was basically...
Took away the magic.
Totally, right? So the magic was completely gone. And then now, it's so really pure magic. So I really like the word magic in this context. But to be honest, I only discovered the magic once I was, let's say, released from this pressure about it. So lyrics is a very important part. And since, I also have Middle Eastern roots, obviously, so coming from Iran, and also in Iranian culture, lyrics is absolutely important and has a long standing tradition.
Do you actually speak Persian?
Yes. So this is also something that, of course, I now consider as a fantastic opportunity to be able to read Persian literature in original. Of course, in some things I'm not that good anymore, because I also, again, not the smartest in the room. I need to check. But the magic and the knowledge and the wisdom and the experience that you gain by, be it lyrics, be it big, great books and novels, this is amazing. This is really amazing. And again, I have to say, it's not that every day I have, 2 hours for reading, certainly not, but it's a part of my life. And also, whenever we go on vacation, whatever, it starts already in the mind when all of us think, so which books do we choose now for our vacation? And then my husband, my daughter, myself, so we are thinking, so which one to take? Because this is such an important part of our life.
And do you have a typical spot where you go on holiday?
Not totally typical, but we love Crete, really the island of Crete. Magic, absolutely magic. And of course, other countries are also very interesting. But if you ask that question, I would, my spontaneous reaction would be the island of Crete is an amazing place.
So from holidays, we'll get back to Tübingen. And I'd just like to know, what does it mean to you to do research and work in Tübingen and specifically at the University of Tübingen?
I think Tübingen is absolutely leading in this collaboration and interdisciplinary mindset. So really having a culture of collaboration and interdisciplinary work. This is not only something that is, written on the homepage or written somewhere, or it's, let's say, part of the university strategy, but it's really part of daily life. And I can really tell everyone from my own experience, so after now 10 years as a professor here in Tübingen, this is really remarkable. And I really think that this is a major factor of our successful work, that we think collaborative and have this highly interdisciplinary mindset. I think what helps is that Tübingen as a city is of course quite small. So distances are so short. It makes, of course, also the private life much easier. Yeah. So my daughter, it's just 10 minutes going from home to school, right? And it's not like having a 50 minutes drive somewhere. And also for going to colleagues at different institutes, you can just walk, right? And meet. And I think this is also a very unique feature that it's fantastic. Yeah, and I could not right now imagine really that there are a lot of other places that combine on one hand, the specific topics that I'm passionate about in my research, and this would be neuroscience and oncology. These are at a very high level in Tübingen, and of course the clusters, and in addition, this working culture. I think this makes this place very unique. For me, at least.
Well, thanks for this great conversation and giving us insights into your field of research. I have one last question. This would be, what is the key to your research?
The key to my research is contributing as much as I can, or as much as we can in our team, to push boundaries.
Professor Dr. Ghazaleh Tabatabai, it was a great honor and pleasure having you here today in this podcast, and I thank you lots. This was Key to My Research, a podcast produced by Changing Time in cooperation with the University of Tübingen. You can find information and the links to the sources in the show notes below. To get to know more fascinating scientists, please subscribe to the podcast, leave a review, and recommend it to your friends and colleagues. I'm Jennifer, and I'm looking forward to seeing you next time.